Hello everyone, my name is Dan Redziniak and I'm an orthopedic surgeon here at Anne Arundel Medical Center, and this is Hanna Golom, who's going to be assisting us today in jump screening. Today I'm going to be talking to you about the ACL tears. ACL stands for anterior cruciate ligament, and it is the ligament that is found in the middle of the knee. It is torn in this model, and it prevents the knee from translating this direction. When that ligament is torn, you develop instability of the knee. It is the most commonly torn ligament that requires reconstruction, and women tend to be 8 to 10 times more likely to tear their ACL, and it's felt to be related to the fact of the alignment of their hip, the knee, and the ankle. The overall alignment in women tend to be a little bit more knock-kneed, secondary to wider hips, and their knees tend to fall in or assume a knock-kneed posture. That alignment, especially when jumping and cutting, predisposes women to ACL tears. So we're going to do 2 screening tests to determine if your female athlete is at risk for an ACL tear. Hannah, the first test that we're going to do is a single leg squat. Do the incorrect first. So come on down. You can see when she goes down, the overall alignment of her leg tends to be in the knock-kneed posture. That puts the ACL on stretch and predisposes her to a tear. Can you do the correct right, please? So that is the correct way, and you can see that both her hip, knee, and ankle are all in one line. That demonstrates adequate strength and not predisposed to an ACL tear. The other test that I'd like you to do, Hannah, is stand on the chair, please, and then jump and do the incorrect way first, please. So on that landing, you can see that both knees tend to fall in. That posture, again, predisposes to ACL tears. Can you demonstrate the correct way to land? That is appropriate. You can see that her knees are not falling in, and that landing there tells us that her muscles have adequate strength to control her jumping and cutting activities. If your female athlete has any of those positive tests, the best way to correct that is with rehabilitation, and that you need to strengthen your hip, your core, and your thigh muscles to completely address those landing and cutting techniques. And studies have shown those rehabilitation techniques can decrease the risk for ACL tears in female athletes.